Hi, my name is Sophia Blaney. I'm the speech therapy coordinator here at Cooperman Barnabas Medical Center. Today, I will be discussing the impact of strokes on a person's speech and swallowing function, as well as our role as speech pathologists for their road to recovery. So what is aphasia? One of the most traumatic effects of a stroke is losing the ability to communicate, a condition known as aphasia. Up to 40% of all stroke victims have their ability to speak or understand speech affected to some degree. It is our role as speech therapists to help patients regain some or all of this important function. Communication problems caused by aphasia consist of difficulty speaking, reading, writing, gesturing, using numbers, understanding the speech of others. Aphasia affects everyone differently. It's important to know that intelligence is not affected. So what to do when communicating with someone who has aphasia? It is helpful to know to minimize distractions in the room, keep it simple, be patient, and give the person time to speak. Include them into conversations like you normally would. Like mentioned before, aphasia does not affect a person's intelligence. They're still very much aware of what's going on. As for communication with someone who has aphasia, it's important to be patient with yourself. Use assistive devices such as a communication board or gesturing to supplement, as well as letting people know what form of communication works best for you. For example, does it help if the speaker only asks yes or no questions? After a stroke, a person may also suffer from dysarthria, which can inhibit communication by causing weakness in the muscles used to speak, causing speech to sound slower and slurred. Unlike aphasia, dysarthria does not affect the patient's ability to understand others or find the right words to say. This affects approximately 40% of stroke patients. Apraxia is another language-related condition that can result from a stroke. Apraxia of speech is when an individual has difficulty planning or programming the muscles required to produce speech, but there is no injury, weakness, or paralysis of those muscles. You may see groping movements in the mouth as the person tries to speak. Someone with this type of impairment will speak slowly and lack the normal rhythm of speech. Unfortunately, cognitive deficits are a frequent complication of a stroke, affecting as many as 2/3 of survivors. The physical changes to the brain tissue caused by a stroke can lead to diffuse cognitive deficits, including problems with attention, memory, executive functioning, and information processing. According to the National Stroke Association, nearly 2/3 of the estimated 7 million stroke survivors in the United States will end up with some level of disability. Receiving rehabilitative treatment by physical, occupational, and speech therapists can significantly improve these disabilities. Speech therapy sessions typically start with an assessment to establish a baseline of communication abilities. Using the results of this assessment, therapists recommend an individualized recovery plan for the patient. Much of our work as speech therapists revolve around neuroplasticity, which is the brain's natural ability to rewire itself. By activating neuroplasticity, the healthy areas of the brain get stimulated to take over the function of language. Because neuroplasticity is sparked by repetitive stimulation, working through various speech therapy exercises with a clinician will encourage new areas of the brain to take on the functions of communication. Lastly, a stroke may cause a swallowing disorder called dysphagia. If not identified and managed, It can lead to poor nutrition, pneumonia, and disability. Approximately 50% of stroke patients have difficulty swallowing, placing them at risk for aspiration pneumonia. So what is aspiration? As mentioned before, swallowing problems can lead to aspiration. Aspiration describes a condition when food or fluids go into the lungs, putting the patient at risk for a potentially life-threatening lung infection called aspiration pneumonia. Unfortunately, approximately 30% of stroke patients will develop pneumonia. So within 24 hours of being diagnosed with a stroke at the hospital, a speech therapist will evaluate the patient and begin treatment immediately. This is an important part of recovery. Speech pathologists will assess and treat patients by finding the safest and least restrictive diet, providing strategies and exercises to improve swallow function. Treatment plans can consist of diet changes, learning techniques that can help make the swallow more effective, using aids that can help the patient eat or drink more easily, and provide exercises that strengthen the muscles in the face, tongue, lips, and mouth that facilitate swallowing. So here are some examples of what dysphagia diets look like. Altering the consistency of food and liquids is a fundamental aspect of dysphagia management. During the swallow evaluation and treatment, the speech-language pathologist decides what texture of food and thickness of liquids are safe to eat and drink, as well as what techniques are needed to prevent choking. Solids range from regular diet with no restrictions to puree diets that are foods that are smooth and easier to swallow, even without teeth. Then there is a range of thickened liquids. Thin liquids, like liquids that we drink every day, may be one of the hardest things for a stroke patient to swallow. And the reason for that is that they tend to go down the throat quickly before a patient is able to protect their airway. Therefore, liquids are thickened in order to go down slower and to prevent aspiration. According to studies, 8 to 10 hours of treatment per week has been shown to improve a patient's progress compared to those not receiving consistent treatment. The speech therapists at Cooperman Barnabas Medical Center work with patients within the first few days after suffering a stroke, which often helps to make big improvements in their abilities. Research corroborates with these observations, showing that patients who immediately work with a speech pathologist have an increased opportunity to regain speech, swallowing, and other functions. So this concludes my presentation. I hope you found it informative. Thank you so much for your time.